Look who appeared during the break. So I think we have
We
Colleen.
pulled him out of a hat.
Yeah. Do you still have Colleen on the phone?
Yeah, Colleen, how are you?
I'm okay, and I didn't answer your question. I'm 66.
66 years young. You're old enough to be my sister, Colleen. So you have a torn meniscus. Do you know how you tore the meniscus?
Yes. Someone tripped me and broke my foot, but as I came down on my knee, right knee.
And you did not have that repaired because of the finances?
Excuse me?
You did not have it repaired because of the cost?
No, actually, I didn't have it repaired. This was 10 years ago, and I didn't have it repaired at the time because the doctor was so concerned about my foot being broken in half that he wasn't letting anyone else touch me until that foot was fixed.
Well, if that injury is 10 years old, you've developed some pretty extensive degenerative arthritis in that knee. I would imagine the MRI, when you have it done, is going to show bone on bone. You probably have worn out that meniscus.
Oh. So what does that mean?
That would mean that, you know, eventually you're probably going to be a candidate for a joint replacement.
Mm-hmm.
And when I saw this other doctor in Las Vegas or Henderson, he didn't feel like that was appropriate at this point in time.
Well, did he have the MRI in front of him?
No, he did not. He only had x-rays.
Okay. Well, the x-ray is going to show how much more of the pad you have left, but the MRI is going to show definitively what's going on inside of that joint. So I would suggest you have him order you an MRI.
Okay. Well, do you, in your new wellness center, do you handle things like this?
Yes, we do.
Even the shots?
I don't do the shots. Are you doing cortisone in the knee?
Oh, we can do cortisone in the knee, but I think you want to understand what the nature of the defect is. If it's just inflammation or things of that nature, cortisone in the knee works really good the first time you do it, and it works somewhat the second time, but after the third time, you pretty much exceeded the benefits of it. Mainly because it allows you to do so much with your knee. You get some wear and tear. Some people initially get a lot of relief for months. It just depends what the nature of the injury, and that's why Creig was saying to get the MRI, because that tells a lot about the internal structures. It tells how much of the meniscus is torn, if there is any there at all, whether there's so many different, things that MRI tells us that will help to decide whether or not you're going to get some benefit or whether or not you need a partial knee replacement. They're doing those limited, minimally invasive knee replacements now.
Yeah, and they're good.
And they're real good, and people rehab really quick from them. So. Yeah, I mean, you come over there, we'll order the MRI, we can review it, we can inject the knee if it's appropriate. The knee is the only joint I inject with cortisone.
We have Dr. Sipes.
Yeah, and we have an orthopedic doctor in our office to help you too. So either way,
you're taking senior dimensions, correct?
I take senior dimensions, yes.
Okay, because that'll eliminate taking that long ride into Las Vegas for Henderson just to get a shot in my knee, which takes 5 minutes, and then the time involved in getting there and getting back it seems to me a little bit futile.
Well, because Senior Dimension sends all the orthopedic stuff through Nevada Orthopedic and Spine. And it's a big group in town that handles all of the HMO work for both Healthcare Partners and Senior Dimension. So, yeah, I don't know. Do you go to Southwest Medical?
Yes, I was going there. I'm coming back to your office.
Okay.
I'll be seeing Reiner.
So you need to just switch providers, get in so we can order your MRI, and then we'll make a decision on what might be best for you.
Okay. Thank you for your help.
Thanks for the call, Colleen.
You're welcome.
Okay. Bye-bye.
Keep those calls coming.
Yeah.
Let's address the MRSA question that Ray talked about. I don't know if there's an outbreak of MRSA in the jail, but you could answer the question better than I. the significance of something like that if it is occurring?
Well, first of all, MRSA is really an opportunistic infection, as I've talked about. It's an infection that happens because your immune system breaks down or you make the bacteria available to you, or you're too clean, so to say. So if your body is too clean and you kill all the staph epidermidis on your skin, then methicillin-resistant staph can grow on your skin. So I'm not sure if it's because they're using too high-powered. I mean, there can be the issue in the jail where they use too high-powered of a soap. Because they want everybody to be clean, and that could be doing something along that line. So I don't know that you treat it with antibiotics, but that's usually the case. It's just over clean.
Yeah.
We have, is it Charisse on the phone?
Yes. Hi, I'm a patient of yours, Dr. Reiner. Thank goodness. I was actually going to urgent care and some people over there, but they were not very helpful.
Okay.
I was diagnosed diabetic, and all they did is just say, here, take this medication. I didn't really tell me anything about it, but after going to your office, you helped me and got me test strips and everything to actually check that. But my question is, since being diagnosed, I've been following the diet properly. I've actually lost about 35 pounds.
Great.
I have other issues that caused me to gain substantial weight. But my question is, because of my diabetic nerve pain and I have huge cracks and sores on my feet, what can I do about that so I can actually work out more to lose more weight? Because I don't seem to be losing anymore just on the diet alone. And also, how do I schedule an appointment with the other person there, because you referred me to them for my sciatica and the nerve pain, but I've been unable to find the phone number.
Okay.
It's right on the screen, ma'am.
Yes?
Our phone number is right there on the screen.
Okay.
For the Wellness Center?
Yeah, that's what I've been trying to schedule an appointment with, and also about what else to do for my feet and leg pain, because I used to work out 5 days a week, but it just hurts so much to even stand on my feet.
So is it a burning pain?
It is burning at times, and it's numb and tingling, but right now I have big cracks and blisters actually on my feet.
Okay, so you may have another problem with the possibility of maybe even a fungal infection, or you may have some eczema on those feet. So why don't you get back into the office and let me actually take a look at that.
Oh, okay. Thank you so much. Yes, because I've been doing everything you said.
What's that?
Great. I said I've been doing everything you said. I've lost almost 40 pounds.
That's great.
I'm not eating carbs. I'm trying to work out, but when I just stand on my feet, the pressure, it all just kills me. And I want to work out and walk after every meal, but the pain on my feet is killing me.
Well, yeah, and so if you can get in, I can probably give you something for the nerve pain, but I want to see what's going on with the skin to see if there's something we can do to help you with that too.
Oh, okay. I'll make sure I come in right away. I wasn't sure. Thank you.
You're quite welcome. Thank you for the call, and thanks for being a poster child for better diet.
Okay, and again, how do I schedule an appointment with him? I'm supposed to go to the Wellness Center. It's on the screen.
Well, the number is on the screen, the 751-7041. That's their phone number.
Oh, okay. Thank you.
And then they'll give you directions. And it's just right next to the VA clinic and across from the county complex. So it's right in that Calvada Eye on the north side of the Calvada Eye.
Oh, okay. Thank you so much. You guys are great.
All right. Thank you for calling.
Thanks.
Appreciate that. So.
Thank you.
So, yeah, that's excellent. I mean, that's
40 pounds is great.
yeah, that's it's a lot of calories. And you know, weight loss is one of those things. And Teresa, I know hopefully you're still listening. Weight loss is one of those things where you do reach a plateau. okay, you do reach an area where weight loss, you reduce your caloric intake, you basically, it does plateau. And then what happens after that plateau, it does go down more. Because your body basically adjusts to the new level of calories. You can work your upper body. You can do some other things to increase some of that muscle mass that can actually help you lose weight even more, even if your feet are giving you trouble. They're doing that. And I guess we're going to be going to break pretty soon, and then we talk more about the MRSA situation. So
All right.
when we come back, but before we do that, like I said, MRSA is an opportunistic infection. Not many people have it. In the jail, when you're in close quarters, they might do some nasal cultures to see if there's somebody that carries it in their nose. That's one of the areas where it can be, and then isolate that person. But based on my thing about the jail, they don't want to spend any money. Nye County does not want to spend any money on the jail or the inmates. They're required to do certain things, but at the end of the day, it's going to be very limited in what they do. So we may be left putting out fires. So we'll be back from the break in just a minute. Thank you for tuning in.